What's up, everybody? Today is October the 14th. It's a Friday. It's a day after my surgery. It's about, about 30 hours after post-surgery. Got to the hospital yesterday about 5:15. Checked in, started checking in about 5:20. And was actually taken upstairs to start getting prepped by about 5:35, 5:40. Prepping took about an hour-ish, and you can still see my bands that I have on. And prepping consisted of a little bit more blood work, testing, and then they hook you up to pretty much all the monitors to monitor your heart rate and blood pressure and all that stuff. Had to get changed into the gown. They give you specific socks. They gave me, and I'm still having to wear specific, almost like knee-high, or yeah, they're knee-high type legging things, compression leggings. Look almost like what NFL players use, and they're meant to prevent blood clots in the legs. And so they told me to keep these on for about a week. So next Friday I'll be removing these, but for in the meantime I'm keeping them on. So all of this took about an hour. They put my IV about right here. My watch is kind of blocking it right now. You can see the blackness from the tape on me and stuff. Sorry about that. It was a phone call from my daughter's school since she was out. So they took care of all of that. Kind of went over the procedures of what's going to happen. Had to get shaved on my back because it was back surgery. So like I said, that took about an hour. Then my doctor showed up about 6:45-ish. Kind of went over again what was going to happen, saying that it was going to be a microdiscectomy, possible open discectomy, depending on once he got in there. So he kind of went over that. My wife and my mom were in there, and they just kind of wanted to make sure, how the process was going to go. And then that was it. So I kind of had a break for about maybe 15 minutes, waiting in the prep area, already lying down on the gurney or on the bed, being prepped for it and whatnot. And then about 7, I met with the anesthesiologist, maybe about 6:45, 6:50. Anesthesiologist came over, started telling me what's going to happen, the process and whatnot. And then a few of the OR nurses that were going to be in there kind of introduced themselves and just kind of talked about what was going to happen. And then they prepared what's called the cocktail, what they call it. And it's the mixture, and the way the nurse worded it was, this is what's going to prepare you to have surgery, to want you to have surgery, like to say, let's get this over with. And so they put it in my IV, and they have it ready there. And then pretty much around 7:15 or so in the morning, one of the OR nurses said, we're ready to go. Gave my wife a kiss goodbye, and they whooshed me off. And I remember going around a couple of corners, and then I finally started seeing on the doors OR room number 1, 2. Excuse me. I'll explain a little bit about my throat. And then I remember them saying that we were going to be in operating room number 4. So I finally saw the one, and I remember having a conversation with one of the OR nurses, asking, are y'all familiar, like how many of these have y'all done? And he said, I've been with your doctor, Dr. Albert, for over 5 years, and the other doctor from your offices for about 7 years. So all in all, they've been doing this for a long time. So that made me feel a little bit more comfortable. And then all I remember is being wheeled into the operating room, being super, super freezing cold in there. And then there was about 5 people in there. Never really saw my doctor, Dr. Albert. I just heard him, so he was kind of far off in the corner, I guess, getting the tools ready and whatnot. And I remember them laying me down on the bed, and one of the OR nurses saying, let me know when it starts to hurt and I'll stop. So they told me, you know, they laid me down. I told him, okay, it hurts there. He stopped. And then I remember them putting the gas mask over my face and pretty much just saying, take super, super big breaths. So I remember taking about 4 or 5 breaths, and that was pretty much it. I took the 4 or 5 super, super, super deep breaths, inhaled what they said was pure oxygen, and then I guess that's when they hit me fully with the cocktail and the anesthesia, you know, all the things that Porpothol or whatever you call it, however you call it. And the last thing I remember is taking those huge breaths with the mask on and looking up, and then the next thing I knew, I was waking up. And it was, the best way I can describe it was one of those super, like, heavy sleeps where you feel like you're just about to hit that deep sleep, and then somebody wakes you up, so your eyes are like super hard to wake up and they feel really heavy. And I remember opening my eyes and looking around, and I saw people in different bays kind of in the same thing. They were still on the gas, or there were some people that were kind of getting up and people were helping around. So it's a very surreal environment, you know, there's people everywhere and whatnot. So, and I just remember trying to keep my eyes open, but still at the same time could feel myself falling asleep and snoring. So I kept telling myself, you know, you gotta get up, try to get up. And then the nurses kept saying, how you doing, Mr. Ortiz, how you doing? I kept, you know, saying, oh, I'm doing okay. And then I finally had to ask, just because, you know, in my mind, I'm like, I know it already happened, because I remember before, I'm like, but I told them, I asked the nurse, I was like this with my eyes closed and said, I think I know the answer, but are we done? And the nurse was like, yes, you're done, you did great, everything came out great. The doctor said that everything was a success. So I said, okay, great. And I was still heavily medicated under the anesthesia or whatever, so it took me about 10 minutes, I would say, to finally, maybe 15 minutes from the point I can remember waking up, to kind of being able to keep my eyes open a little bit and look around. So it took me a little bit of time. I'd say 20 minutes in all I was there in what they call recovery number 1, recovery phase 1. And then so after I get used to that, I kind of take some big breaths. The nurse kept saying, take huge breaths, and then, you know, breathe large through your nose and let it out through your mouth. So I kept doing that. She took off the little gas mask because it was kind of still here. And then she told me, you're going to have a sore throat now, which is why I keep doing this. Since they had to put a breathing tube down my throat, she said, you're going to have a sore throat for a couple of days, which yesterday was probably the worst. Today is a little bit better, but it's still kind of hard to swallow. And so everything else was taken off of me as far as like the breathing and whatnot. They took off my little medical hat and then wheeled me into recovery 2. And I remember being wheeled into recovery 2, and that's pretty much where I was the first time when I was getting prepped, just kind of in a different area. And my family was able to come and see me, and I was pretty much discharged. They checked everything else. I was able to drink something, so they gave me apple juice. They asked me, do you want apple juice, cranberry juice, water, Gatorade? And for some reason apple juice just sounded delicious. And of course, haven't been able to drink, or me haven't been able to drink anything since midnight the following day and whatnot. So I requested apple juice, and it tasted amazing. First thing to drink for so long, and it was a sugary type drink, so it kind of helped. And that was it. And they went over some discharge things, especially since it's back surgery, you know, and they asked if I had a back brace, which I do. The back brace that the doctors, the neurologists that I went through, they gave me this amazing back brace, which instantly kind of cinches me and makes me straight. So I use it, or been using it ever since. So yesterday came home and wanted to vlog yesterday because I felt great. I felt great when I got home, but then They told me the second I got home to take my medication, and so I did. I didn't take a muscle relaxer. I have Valium as a muscle relaxer and didn't take it, but I took the Tylenol, so that way once the anesthesia wore off and once everything wore off, I didn't want to be in pain, and so they recommended as a precaution to kind of keep up with it, to take my Tylenol. But if the Tylenol did not work, the Tylenol with codeine, Tylenol number 3, to call my doctor's office immediately, so that way they can prescribe me something more if the pain comes back. No leg pain as of pretty much after I woke up from the surgery. I could not feel any pain. Obviously, like I said, I was probably still under the effects of the surgery and the anesthesia, whatever painkillers they gave me. Kind of sore though in my bottom calves, kind of like if I did a lot of squats or a lot of, lifts. But because of the way you are for back surgery and you're prone and your whole body mass is on there, there was a chance of bruising, which they let me know at the beginning. And so I kind of had that going, that feeling going in. And so they told me to expect that, but to keep up with my pain meds, so I did. But yesterday was just still kind of super groggy, and so was in and out of sleep, constantly lying down, and just wasn't really feeling vlogging. So I waited until today, and here I am now. Like I said, it's 5:15 the following day, so we're looking at, almost, pretty much like 18 hours, if I did that correctly. But I got to the hospital, like I said, at 5:15, started checking in by 5:30 when they allowed, and the surgery was supposed to be at 7:30. I went a little earlier, but the reason I'm saying that is the entire thing, I was in the car coming home by 10:30. So all in all, that was amazingly fast. It stayed as a microdiscectomy. The incision is about that big, so about 1.5 inches or so. Not very large. He said everything went well. He was able to pull the disc that was herniated and what was touching and pulling on my sciatic nerve. So far my pain has been minimal. I have been trying to walk around my house. Later on this evening, me and my wife and I are gonna try to walk to the mailbox, which is about probably a minute walk. It's real close. To go get the mail and try to use that as a way to measure how far I can walk. Walking little mini laps in my house from my front door to my back door. Do that about 10 times, and it kind of gets the back of the legs a little sore, so that's when I kind of take it easy and sit back down, trying to minimize my sitting to about 30-45 minutes at a time, and then getting up and walking for about 10 or 15 and just kind of repeating that is what I've been doing so far today. Appetite yesterday. Before I took my meds, I wanted to have something in my stomach, because they did recommend to do that, because taking meds on an empty stomach after just coming out of surgery is pretty much a cocktail to throw up. So I did not want to throw up. I'm not the type that likes to throw up, and I haven't thrown up in forever. And the way the nurse said was throwing up is going to cause strain on your spine. So she recommended I eat something, so I made a bowl of chicken and stars, and my wife made me a bowl of chicken and star soup. Took that down, and then took my pills, and pretty much was in bed all day yesterday, with the occasion of dinner. The nurse recommended for me not to eat anything greasy the first go round, but if everything was good for lunch, then dinner I could resume. So my wife and father were here, and my daughter were here, and they wanted pizza, so we ordered pizza. I ate like 2 slices of the real small little squares, so really maybe that equals to maybe a full slice, or not even that. And that was it. And I fell asleep, and then today has just been oatmeal and soup again. Nothing really too heavy. So yeah, just kind of wanted to give you guys a quick update. So far so good. I do not have that nagging leg pain. I do have the back of the calf kind of soreness. I just popped a Valium not too long ago and took my meds. So pretty much just going to be bed rest for the next couple days, with a little bit of walking that I've been doing. My goal is by hopefully, today's Friday, hopefully by Monday, I'm gonna start doing a little bit more walking. That's gonna put me, what, 4 days out? If I don't count Thursday, yeah, that'll be the 4th day. So I'm gonna try on that 4th day to walk a little bit further and try to keep that going and try to make it twice a day where I can walk maybe 5 minutes and then 5 minutes back. But I'm gonna try to keep that up. Then I have my 2-week appointment here on the 23rd of October. So at that point, hopefully I get good news. Hopefully the incision does not have an infection. My wife has been super helpful in swapping out the gauze on my incision and just helping me out overall. So I just kind of wanted to update you guys on what's been going on. I will try to make one here the next couple days. My goal was daily, but will just all depend on how the meds work and stuff. But I'll try to update you guys here in the next couple days if I don't do it daily. All right, y'all take it easy.